Without further ado, Georgia Eade.
All right, so good morning again, everybody. I just wanted to say before I start that I have to leave right after my talk to catch a flight back to Massachusetts. And
Are your flights going?
yes, last time I checked. And so I just wanted to thank everybody. It's been such like an intellectual smorgasbord, and especially Dr. Michael Eads this morning, just an amazing talk. And so it's just been great to be part of all this. So my talk is about histamine intolerance. I just first wanted to see how many people in the room have heard of histamine intolerance?
Because of you.
Everybody.
Yes,
Oh.
exactly.
Everybody. How many people have encountered patients with histamine intolerance or tried to treat them? Couple, 3. Mm-hmm. And how many people in the room think they might themselves have histamine intolerance? Lena. And Lauren. And Dr. Eads. And I'm number 4. So anyway, this talk was born out of my own personal experience and then a lot of research. So the way the talk is going to go today is first we're going to ask the question, why should we care about amine intolerances? What are biogenic amines? Then we're going to focus specifically on what histamine is and how it behaves. Then about histamine toxicity, which can occur in any person, to any healthy person. Then we're going to talk about histamine intolerance, which only happens to some people. And then we're going to talk about diagnosis, prevention, and treatment of histamine intolerance. So why should we care? These are the kinds of foods which are high in histamines and other biogenic amines. A lot of faves among the low-carb crowd, fermented meats, cheeses, and there's a big fermentation fad going on right now. Lots of people believe that fermented foods are healthy for their gut because they're teeming with bacteria, and they're also teeming with biogenic amines, as is aged beef, which is also very popular right now, which has been sort of pre-digested or fermented by bacterial organisms. And the main reason I think that we as physicians need to be aware of histamine and other amine intolerances is because often you'll encounter patients who switched to one of these diets, a paleo diet, a ketogenic diet, GAPS diet, low-carb diets, and they either don't feel better when they change to these diets, or in some cases they may feel worse. And this is exactly what happened to me. I'd been eating a low-carbohydrate, mostly meat diet for a number of years, and was feeling a lot better on that from a variety of food sensitivities I developed in my early 40s. And then I heard Dr. Rosedale and Dr. Zyfried talk at the Ancestral Health Symposium in 2012, where I was giving a talk about vegetables, con, not pro, and I became very intrigued by the ketogenic diet, and I thought I would try it myself and write about it on my website for people to take advantage of my unusual experience. So when I went on this diet, I started having a lot of my old sensitivity symptoms back, some migraines and fatigue, stomach pain, ankle edema, just intermittently, and I couldn't figure out what was going on. And then a reader wrote in who happened to be a local colleague psychiatrist who said, I wonder if you have a histamine intolerance. And so I looked into it, and that's sort of how this blog post came about a few years ago, and how this talk came about. So what are biogenic amines? Biogenic amines are the amino acid, the naturally occurring amino acid in fresh foods without its carboxyl group. A decarboxylating enzyme, which primarily exists in bacteria, but also in our own bodies to degrade endogenous amines, and we'll get to that in a minute, chops off the carboxyl group, and then you have a biogenic amine. So it's just an altered amino acid. And histamine is one of the most widely known, although I think most people have also heard of tyramine. But there are other biogenic amines in the world, and some of my favorites, a couple of my favorites, putrescine and cadaverine, which I have lovingly nicknamed smelly and spooky. So there are lots of biogenic amines in the world, and they are there for a reason. So these are signaling molecules that have very specific effects on receptors, and they modulate all kinds of things: cell growth, hormone release, nerve cell activity. So we create them in our bodies on purpose in tiny amounts in specific areas, to do specific things. but then as soon as they are released and they have attached to their receptor and done their work, they are immediately destroyed. So they do not accumulate in our bodies under normal circumstances because they can really wreak havoc on your system. So they live fast, they die young. In healthy people, they're immediately degraded by various enzymes. In the case of tyramine, it's MAO. In the case of histamine, it's diamine oxidase. And this is an intracellular enzyme which can detoxify both. And so in a healthy person, we have plenty of these enzymes to help us for these, so that they won't accumulate in our systems. So histamine in particular, we'll take a look at and see exactly what it is. This was the bane of my existence in medical school, trying to remember what histamine did depending on which receptor it was attached to. So again, histidine is the amino acid, and histamine is the biogenic amine, the signaling molecule. And it's histidine decarboxylase that is the enzyme that carries out this reaction. There are 4 different histamine receptors scattered throughout the body, H1 through 4, and depending on which receptor it attaches to, it can have a wide variety of effects. So in the brain, it's primarily responsible for sleep-wake regulation. And it's, as far as I can tell from the literature, histamine is not supposed to cross the blood-brain barrier. So, but it attaches. If you eat a food that contains histamine, depending on which receptor it attaches to and which organ system you're talking about, it can have a staggering array of biological effects, some of which oppose each other. So it's really very, very complicated. So within our bodies, these are the cells that make histamine. The main source of histamine in our bodies are mast cells and basophils in our immune system. These are responsible for things like allergic reactions and inflammatory reactions. The enterochromaffin cells in the gut, in the stomach in particular, which trigger secretion of gastric acid. Histaminergic neurons, both in the central nervous system and in the periphery, and gut bacteria. So gut bacteria, depending on the type of bacteria, may contain the enzyme histidine decarboxylase that turns histidine in fresh foods into histamine. So some bacteria in the gut do that, some bacteria that land on foods or live in foods will do that, and it really just depends on the type of bacteria. The normal response to food in a healthy person is that we are constantly secreting DAO, the enzyme that breaks down histamine, into our guts. It's just constantly being released, and that's our first line of defense. So if you eat something that has histamine, a nice piece of ripe cheese, this is your first line of defense. The DAO will come out and attach to the histamine and break it down. If it makes it through that first line of defense, there's this intracellular enzyme, histamine N-methyltransferase, which will degrade the rest of it, or almost all of the rest of it. So most people can tolerate a decent amount of histamines in their diet for these reasons. About 50 to 100 milligrams per kilogram dose in the average healthy person.
Is that per meal, per day? What?
Well, that's per food. The way they determine it is by per food, so it's sort of per amount of food. So, and that's an excellent question, though, because how you respond to histamine depends on how many of these foods you eat and at what time and all of that. So it can become very confusing to figure out what food is bothering somebody. And these are the sources, the exogenous sources of histamine, if you will, from the outside. High histamine foods, things like cheese and red wine and salami and things like that. And I'll show you a longer list later. High histamine foods, high histidine foods. These are foods that naturally contain histidine when they're fresh. But if you leave them out too long, or if you are eating leftovers 5 or 6 days later, bacteria in the environment can start to degrade these foods, which are normally not high in histamine, and over time they will accumulate histamine. And then there are trigger foods which may or may not have much histamine or histidine in them, but they directly trigger mast cells to release histamine for whatever reason. So this is a list of examples of high histamine foods, and it really runs the gamut. So you can see some foods some fermented foods are rather low miso and sour cream, 3, 6, just a few milligrams per kilogram. But then some foods are astronomically high in histamine, especially certain ripe cheeses and dry sausages. And I want to point out the alcoholic beverages because most alcoholic beverages do not have biogenic amines in them, but the exceptions are red wine. There are some histamine-free red wines, but it really depends on how they're produced. Lots of factors go into the production of red wine. They vary a lot from producer to producer. So some can be high in histamine. Champagne tends to be high in histamine, but most other alcohol beverages don't. So what are some of the foods that are naturally high in histidine? They include spinach, tomatoes, eggplant, and certain kinds of fish. We'll go into that a bit more detail. But if these foods are hanging around for a while, you could get some histamine production out of them. These are the most complete list of trigger foods I could find, gathered from a variety of sources. And so notice that some foods can be both histamine triggers and naturally contain histamine and or histidine. So some of these foods you get more bang for your buck. So histamine toxicity, which can occur in anybody sitting here, if you eat too much histamine for your natural defenses, you will get sick. So it's really the dose makes the poison, and all of us have an upper limit of how much we can tolerate. So these are the three, so it's really a matter of degree. So these are the three types of reactions people can have to histamine. Anaphylaxis is very familiar to everybody. If you're allergic to peanuts and you eat one peanut, it will trigger your mast cells in your body to release massive amounts of histamine in your bloodstream, and it's extremely dangerous. Scombroid poisoning is basically just, we'll talk about it in a minute, and then histamine intolerance, where people can react to smaller amounts of histamine. So Scombroid poisoning is basically food poisoning that occurs if you eat mishandled fish or fish that's been sitting around too long. And the amount of histamine in the fish can exceed 500 milligrams per kilogram. And remember that the average healthy person can tolerate maybe 50 to 100 milligrams per kilogram at a time. And to make things even more complicated, most biogenic amines don't exist in isolation. So, bacteria, a variety of different types of bacteria may contain a number of different enzymes which break down a number of different amino acids into a number of different biogenic amines. So we rarely, if ever, see histamine in isolation in a food. It's almost always sitting there with lots of other biogenic amines, most importantly, putrescine and cadaverine. So what is Scombroid poisoning? It's a very strong, immediate reaction, almost immediate reaction to spoiled fish or seafood. And these are the kinds of symptoms you can get. If anybody in the room has ever experienced this, it's really quite striking. This happened to me a couple times when I ate supermarket scallops. So you won't forget it if it's ever happened to you.
What kind of scallops?
Supermarket scallops. They've just been, I'm sure, weren't as fresh as they could have been. And the reason why it's why it's called Scombroid poisoning is because many fish are very high in histidine. So they're caught out at sea, and then they have to get brought to land, and then they have to be packaged and brought to the store. So sometimes they've been, they're not very fresh.
Wow, it's a lot of fish that we normally recommend.
Mm-hmm. Exactly, but as long as it's fresh, you don't need to worry about it. But sometimes they're, because of transportation issues and so forth, they may not be as fresh. So that brings us to histamine intolerance, which is, an exaggerated reaction to normal amounts, so to speak, of histamine. So at less than 50 milligrams per kilogram, people can have symptoms. Now their blood pressure isn't going to drop, and they're not going to pass out or anything like that, and they're not going to go into shock, but they're going to feel miserable. So these are the kinds of symptoms you can see in people with histamine intolerance. Notice that a lot of them look exactly like an allergic reaction, but a milder version of an allergic reaction. And people can get some of these or all of these. And notice, to make things even more complicated, that you can get high blood pressure or low blood pressure. And the reason for that is that histamine itself lowers blood pressure. It's a vasodilator primarily. And but it can also trigger the release of other catecholamines, which then raise blood pressure. So it can be confusing for people to try to figure out what's going on.
Are there any reports of acute MI secondary to histamine reaction?
Not that I know of, but I did come across a paper documenting coronary artery spasm as a response to histamine intolerance.
Is it fair to say that the histamine reaction, it's not immune, it's not IgA mediated?
Right, exactly.
It's confusing, but it's different.
Exactly, yes. So the most common cause, the consensus seems to be the most common cause is gastrointestinal compromise, which can happen over time with age or with gastrointestinal diseases which damage the lining of the intestines. The DAO is the enzyme that breaks down histamine is primarily located in the intestine and the ascending colon. And so any disease that affects the integrity of the gut lining in those areas can put a person at risk for histamine intolerance, even temporarily. So people who are undergoing chemotherapy, for example, can become temporarily intolerant to histamine. Some people have genetically low DAO levels. There are many medications that interfere with DAO, and I'll show you a list of them shortly. So that will lower your tolerance. And then the DAO enzyme requires all of these cofactors. So if someone is a significant deficiency in any of these cofactors, they may be more histamine intolerant. The prevalence is probably much, much higher than 1%. I certainly didn't realize I had it until someone pointed it out to me. I think most people don't realize, how they're responding to a lot of the foods they're eating. So it's at least 1%, probably much higher, and the vast majority are middle-aged. And so to me, this happened in my early 40s, as I said. And it's much more common in women because estrogen and histamine reinforce each other, and about 80% of cases are in women. So in histamine intolerance,
Georgia, can I ask?
Yes,
Do
yes.
you mean by reinforce each other that they're detoxified by the same pathways, or that there's some way that they actually stimulate each other's levels?
I wish I could answer that, but I couldn't find the answer to that question. Yeah,
I think it's probably the detoxification.
it's a really good question. Yeah. So histamine intolerance can mimic a lot of common female complaints: menstrual cramps, migraines, even hot flashes, and perimenopause. Can be because one of the jobs of histamine, for example, is to contract uterine muscle, so it can worsen premenstrual cramps. And it's kind of important to think that histamine intolerance can vary depending on where a woman is in her cycle because estrogen levels are fluctuating. And in pregnancy, the placenta secretes a huge amount of DAO to protect the growing, developing baby from any excess histamine that might be in the mother's bloodstream. So when women are pregnant, if they usually have histamine intolerance, during pregnancy they'll experience relief. Sometimes I wonder if we should call this histamine. So just a little clarifying thing about tyramine toxicity, because some people have written into my website and asked, could I have tyramine intolerance, or I think I have tyramine intolerance. As far as I can tell, tyramine intolerance is really not an issue unless you are taking something that is inhibiting MAO. And I don't just mean MAO inhibiting medications, which we don't really, I'm a psychiatrist, we don't really prescribe MAO inhibitors that much anymore. But there are foods that can inhibit MAO. And this can get confusing because some of the symptoms of tyramine toxicity and histamine toxicity are the same. Tyramine toxicity primarily causes high blood pressure and headaches. So, for example, our friends Smelly and Spooky, they can inhibit MAO, and so they are MAO inhibitors. Now, you're not going to, depending again on the dose, you may not see much of an effect, but some people get very bad migraines after eating certain kinds of food, and they think it's histamine, but it could be tyramine. So it's just interesting to think about. And alcohol itself is a DAO inhibitor. So if you have an alcoholic beverage, even one that is not known to have histamine in it, and then you eat something, let's say you have a glass of, let's say you have a stein of beer, but then you have a big piece of salami with it. Maybe normally you can tolerate salami, but then on the day when you add the alcohol to that meal, you won't be able to tolerate it. So it becomes really confusing for people to figure out which foods are triggering them, because it all depends on what else they're eating and drinking. So because of all this, because it's so complicated, there's a lot of skepticism in the medical literature about this condition, as there often is with so many food intolerance issues. Sometimes people just think you're crazy. You go to the doctor and you explain these things, and they have no way of telling you whether you're right or wrong. So they just oftentimes will dismiss people who have these complaints. And when you look at the studies, it's hard. Many of the studies don't support, because of the way they're conducted, they don't support this notion. I mean, there are definitely studies that do, and I'll show you what I mean, but when you look at them as a whole, it's easy to be skeptical. But when you listen to people's personal experience, including mine, it's clearly real. I mean, that's what I tell people: just listen to your bodies, do your own experiments, and figure out what's going on for yourself, and you can learn a lot from that. Here are a couple of comments from my website. This article I wrote about histamine intolerance was strangely popular. I had no idea how many people were out there with histamine intolerance, and it's still the article that's the most read article on my site. A lot of people write in. So this person, Victoria, after a bout of angioedema, food allergy tests all negative, I went on a low histamine diet, and the rest of my health problems went away, including some things I never expected. And this person here, ever since eliminating histamine-rich foods from my diet, all of these symptoms have abated. Tachycardia, anxiety, swelling ear canals. People have various experiences, quite unique from person to person. The diagnosis is really difficult. You have to rule out other things that could be causing the same types of symptoms, especially food allergies and other food intolerances. Mastocytosis is a rare genetic disorder where you have too many mast cells. Adverse drug reactions, and somatization disorder. So the reason why diagnosis is so difficult is the tests are not very reliable. You can measure someone's serum DAO level, though that's really not where the money is. The money is in the lining of the gut. If you measure the serum DAO level, which a lot of people have done in studies, it's very unreliable. The levels are very unstable. It's a fleeting enzyme in the bloodstream, so you get a lot of false negatives and quite a few false positives, so it's a very unreliable test. There's one of the reasons why there's so much skepticism in the literature about this being a real condition is because one of what used to be considered the gold standard of histamine intolerance diagnosis is something called an oral challenge. So you give somebody 75 milligrams or 150 milligrams of pure histamine, and then you wait and you see what happens and see if they develop any symptoms. And about 50% of the time they don't. But the reason I think that this may be happening sometimes is that we don't encounter pure histamine in the world. We encounter histamine mixed with all kinds of other biogenic amines, and we're eating them throughout the day. We're not eating them in one dose, and so they can accumulate and reinforce each other throughout the day. So that kind of a test is a little too clean, actually, to mimic real life experience. And you can do biopsies. As far as I can tell, they're rarely used. My understanding is that they're expensive. It's an invasive test too, and I think most insurance companies probably wouldn't cover it. So there is one test that you can
What would you biopsy?
The intestinal lining via endoscopy, and it has been done, but usually for research purposes. So the skin prick test is actually not a bad test. This is only in the past few years, and we used to think that skin prick tests were not reliable, but it turned out that the clinicians weren't waiting long enough. If you wait 50 minutes, then you get a sensitivity of about 79% and specificity 81%. So it's not the size of the wheals, it's the persistence of the wheals after the skin prick test, which can be helpful. But really, if you ask me, the gold standard is self-experimentation, which is true for most food intolerances. There are no good tests, so with a little trial and error, you can figure it out. This is actually my food diary right there from years ago. If you get better on a low histamine diet, then there's your answer. So it really is about trial and error. It's about believing your patient, first of all, which I know we already do in this room anyway, and then encouraging them to go on a little journey of self-experimentation. but it can be frustrating because it's such a complicated condition. So many foods contain these biogenic amines. So what is a low histamine diet? A low histamine diet is basically a fresh diet, and that doesn't contain any aged or preserved or smoked or cultured foods or beverages. You avoid that short list of foods that is naturally high in histidine, because they can, if they're not absolutely fresh, decay into histamine. Any foods that trigger histamine release, foods that inhibit DAO, and alcohol. And you don't have to do this for very long, maybe a couple weeks, maybe a little longer, just to see if you feel better, and then you have your answer. The medications that I was mentioning that inhibit DAO, there are a lot of them, but the ones in red are the ones that we see most commonly in clinical practice. And note NSAIDs. So NSAIDs inhibit DAO, and that's another confounding factor, because let's say on one day I can have a piece of cheese and be fine, and a week later I can have a piece of cheese and not be fine, and then I don't know what's going on. But what if I took Advil one of those days and I didn't take it the other day? So what if I had a drink later on that? It's just really complicated. So there are things that you can do to try to improve your histamine tolerance, correct any deficiencies there might be. Medications, I don't like to go down this route. I prefer to change, to do dietary strategies for myself anyway. And DAO supplements are available. I'm trying one now myself to see, how it goes. They're rather expensive, but they can be very helpful. The trick with them is that you have to take them no longer than 20 minutes before you eat something that you suspect might contain a trigger food, because it has to be right there in the gut with the food that you're eating. So, and now the practical problem in daily life, trying to find fresh foods or foods that are low in histamine, is that histamine is indestructible. Once it has been formed in a food, you cannot get rid of it. There is no method for getting rid of histamine that has been formed in a food. So the best you can do is arrest the bacterial process. As soon as you buy a food, you want to put it especially meat or fish, you want to put it immediately on ice, and that slows the process way down, the histamine production way down. If you freeze the food, it will destroy the enzyme, but it doesn't destroy the histamine that's already there. If you cook it again, it'll destroy the enzyme, but it won't destroy the histamine. And if you cook a food and then you let it sit around for a few days in your refrigerator, more histamine could be produced over time. So, some of the logistical helpful things that I found for myself and for people who write in: check the grocer's packed on date. It's not always there, but try to buy meat where you actually ask the butcher, like, when was this packaged, or look, some foods will have a packed on date, and look how long they expect the meat to last. 12 days. So it's apparently okay to sell this 12 days later, but not for somebody with histamine intolerance. Somebody with histamine intolerance is going to have to buy it as soon as it's packed, or that same day, or maybe the next day. Local foods may be better because they have to travel a shorter distance, so they may be fresher. They're not always fresher, but they may be. And paradoxically, frozen is often better than fresh. It's often fresher than fresh. And frozen at sea fish, if you can find it, is probably the best option for seafood, because then it's not sitting on the boat while it's waiting to leave the harbor and then being packaged and processed and sent to the store. This is my take-home message. Eat fresh. I don't meet at Subway. I have found eating a low histamine diet extremely helpful for my own health. I eat a mostly meat diet. I'd say my diet is about 90% meat. If I eat this way, I feel fantastic. It's very inconvenient sometimes, and socially can be difficult, but it's really worth it if you have a lot of symptoms. The other thing to say is that if you have histamine intolerance, it doesn't mean you can't eat histamine. It just gives you, once you figure it out, it gives you the knowledge gives you the power and the control over how you feel. And so if you know that something's going to bother you and you really want to have it, you can have it. You just know the toll that it's going to take. Or if you really need to feel your best for a particular reason on a particular day, then you know exactly what to do. It just gives you a lot more control over how you feel. So anyway, Any questions? Thank you very much.
I've had patients find difficulties finding a reliable list on the internet of which are the foods that contain histamine.
Yes, exactly. And so I worked really hard in this presentation to double, triple check various resources and only pull in the ones where I saw numerous.
So we can make a handout from your.
Absolutely,
slide.
and the other, thank you for mentioning this, because the other thing I wanted to say is that in preparing for this talk, the other thing I wanted to do to get out of this talk was an update of the post on my website for my readers and for everybody here, and I will put all of this information in that post hopefully pretty soon, so you can have that. And we're going to make a downloadable PDF of tips and tricks and food handling and lists, and so people can just print it out.
Seems like there's a little bit of a conflict between like fermented foods, which are supposed to be good for your gut. So does it help with like leaky gut and things like that? But then you're saying that it's worse for histamine. How do you reconcile those two things?
I can't reconcile them. If you have histamine intolerance, these foods are not going to make you feel good. And I haven't looked into the gut bacteria hypothesis myself. I'm skeptical of it, but I haven't looked into it, so I can't. Until I've looked into it, I'm not sure what to say about it. I mean, I corrected all of my former IBS and gastrointestinal issues by eating this way. And if I had gone that other route, sort of the GAPS diet kind of route, I would have felt absolutely horrible. So it may depend on the person. Yeah.
Is histamine intolerance connected to chronic urticaria?
Yes.
Okay.
Absolutely.
That, so that they would also improve on it?
If that's the reasons, there are many reasons for possible reasons for chronic urticaria, but yes, that's something that should absolutely be recommended and tried to see if that's the culprit. Yes.
Just had a comment back in all my research on the Inuit and reading Bill Howard Stephenson. He said that in the summer that the Inuit fished a lot, and that they would take these fish that they caught and would stack them on cordwood all through the summer, and then in the winter when they froze, they would eat them as treats because they were almost liquefied, and they would eat them like ice cream. And the ones that were the most rotted were the best. I just can't imagine how much.
I can't imagine either. I read that very same passage, and I love those. I love that work. I read the very same passage, and but I also don't know what's destroying our. Is there something about our modern diet that's breaking down our ability to tolerate these things? Although those must have been extremely high in biogenic amines. I can't imagine anybody being able to tolerate. It's a great point. Yeah.
Or its correlation with POTS, postural
Oh, I'm not aware of that. What is that?
Well, orthostatic hypotension, it's a really common disorder among young
yes.
women. It's also a genetically inherited.
Yes.
It relates to mast cell activation disorder. It's one of the side effects of the HPV vaccine that they're studying
Wow.
in Scandinavia.
Oh, that's so interesting. That's a great.
It'd be interesting. I have a couple people with that, not related to the vaccine, but it'd be interesting
You
to
say
put
it's
them on a low.
histamine mediated?
No, I don't know if it's
Mast cell.
histamine mediated. It's mast cell it's activated by mast cells, and if mast cells also release histamine, I wonder if putting those people on a low histamine diet would improve their mast cell activation.
That's really interesting. I hadn't thought about that.
So theoretically, could you probably increase the number of bacteria in the gut that produce DAO?
Well, they don't produce DAO, they produce the HDC, which changes the histidine to
So
histamine.
there aren't ones that actually get rid of, or
Not to my knowledge. So
Maybe
they.
the drug company can develop something.
There you go. That's right. Any other questions?
Thank you.
Great, thank you very much.